Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center, reporting for the week of April 18th, 2022. Today, I will do my best to give a pandemic status update and then talk through some of the recommendations and restrictions, including at our schools, on the airlines, and in public transportation. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to keep yourself, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments by direct message or by email to admin@rootsclinic.org. So as I've been talking about the past few weeks, we know that cases are becoming a less reliable indicator of where we are, and that the CDC's new metrics are very focused on hospitalization, which is kind of a late indicator. So what are we to look at in trying to determine where we are in the pandemic? And I think it's going to continue to evolve, and it also will likely require pulling from multiple sources in order to get the answers we need. And of course, this is disappointing because we've spent the last couple of years building up a lot of ways to collect and report data to the national level, and it appears that some of these are being pulled apart. So I'm going to go through what I think are the most reliable today, and this may continue to change over time. But first, let me show you on the CDC's dashboard. As you recall, they have changed the map from kind of that bright red and orange to this new pastel look. And that is the community level map. And as you can see here, I'm showing you the drop down menu. And at the very bottom, there is a selection you can make called community transmission. And this is the map I'm suggesting that we be looking at, because that is the map that's going to show us by county more about what the transmission levels look like than this green map, which is called community levels. And just by way of refresher, this green map, which is called community levels, is really only looking at hospitalization and hospital capacity. So obviously by the time this thing starts to turn other colors, we're already too late to do anything about it. So that is why I'm suggesting that if you're so inclined, and the link is in the post, that you actually go to the community map and then scroll down to the bottom choice, which is community transmission. It'll take a while to load. It might crash your computer, but this is what you'll end up with. And it is showing what the community transmission rates look like by county. And as you can see here, we are already seeing high transmission rates in many counties, even in California, but in much of the Northeast of the United States, we are seeing increasing levels of COVID-19 transmission. And so cases are certainly sort of heading in the wrong direction in several places, and several places are doing fine, but we will need to keep an eye on what's going on across the country and right here in our backyard as it relates to community transmission levels. And I think this is one way to do that. Now, if we are looking here in Alameda County at the total cases over 14 days, and as I mentioned, I think this is still useful, especially to look at the direction we're going. We might not be able to tell from this on an absolute level how we're doing, just because so many people are doing home testing and because PCR testing is becoming less accessible. But remember that many community health centers are continuing COVID testing. Roots is continuing COVID testing. And as you can see here, and this data actually lags about a week, and then it is giving us the total over the previous 2 weeks. So still lagging behind a bit, but as you can see, it is kind of going in the wrong direction there. So it's a slow-ish uptake, hard to say, but it's a little bit of an uptick here. And so we'll be keeping an eye on that because it is, going in the wrong direction there. Hospitalizations, of course, that again is lagging. So we expect that to hopefully keep on coming down. And it has come down. We're now at 41 people in the hospital, 3 of those in the ICU with SARS-CoV-2. There were an additional 4 deaths recorded since I reported last week, and now we're at 1,862 individuals from Alameda County that have lost their lives to SARS-CoV-2. And when we look at the test positivity rate, once again, here's an indicator that is not going in a good direction. We were down, about 1.4% positivity rate just a couple weeks ago. It's now at 3% positivity rate. Again, it's hard to know exactly what this means because this is very reliant on who is deciding to go get a PCR test. But nonetheless, going in the wrong direction. So we'll need to continue to keep an eye on that. And here is the wastewater dashboard that East Bay Mud is continuing to maintain, and once again going the wrong way. What does this mean exactly? I think we'll get better and better information on this as time goes on, and we understand exactly on a neighborhood level hopefully what all of this means. But right now, as we look at what is a really fairly large swath that includes all of Oakland, these numbers or the numbers of gene copies of SARS-CoV-2 in our wastewater is going up. And like last week, I'm going to go ahead and share what's going on at Oakland Unified School District in terms of their testing, because it's one of the places where we know that we are doing some routine surveillance. And so this has become of interest as we can't really rely on just case data as much. We're going to want to learn who's doing regular routine screening. So I'm asking this question a lot: which hospitals might be doing it, what other venues might be doing it, but we know that the school districts are doing it. And so here again, I'm showing Oakland Unified School District, and the positivity rate is quite low. And it looks like that whatever spike that we thought we were seeing last week may have had to do with incomplete reporting at the time. Now we see that there's a lot more cases being reported here. So 6,000, 5,000, and this is week by week, and still with a pretty low positivity rate. So that's good to know. We know that not everyone is getting tested, but nonetheless, this is certainly promising. And I'll just point out that this phenomena of incomplete reporting or lag time is getting worse, and we're seeing that where cases in some data systems were updated daily before, they're now going down to twice a week or weekly. And now, we're getting lags, especially around holiday times. And so we know that we're seeing some lags in some of the data sets that we look at. But nonetheless, we'll kind of keep tabs on all of this to, again, get an idea of the direction that things seem to be going. And now that folks and the young people are back from spring break, we're definitely going to want to see what things look like in a week, 2 weeks, 3 weeks, as we see if there was any impact of all of the mixing and so on. Now, in terms of news for our local area here, Oakland Unified School District has announced that they will be dropping any mask requirements and moving to strongly recommend, and that will take effect on next Monday. And so I think, and the reasoning is, it seems to be aligned with the state and the county, Alameda County, which have said that it's strongly recommended, but they're not requiring it. So to Oakland Unified's credit, I think that they were one of the last holdouts. They kept the mask requirement in place for this time after spring break, but we're certainly disappointed that myself and a number of other community doctors and community leaders who have been really advocating for our young people, particularly those who are vulnerable, and who will be the most adversely impacted when a universal protection is removed, That's who we're concerned about. And so we were disappointed that this couldn't be continued for the remainder of the school year, leaving time over the summer to really do some work on the schools, the infrastructure, the HVAC, and so on. But unfortunately, it appears that Oakland Unified will be going the route of most other school districts across the state, and dropping those mask protections. So what that means again is that we will see a disparate impact of such a policy on the most vulnerable, on those communities who are the least vaccinated, have had the highest case rates, live in the most dense housing, multi-generational households, etc. So that is who we are going to be most concerned about and kind of keeping an eye on. And I just want to say, because I feel like the communication during this pandemic and the fact that you'll have the CDC do one thing and the state do another thing and the school district do another thing. And I think what has been made clear and explained to me, because at first it was a little shocking, is that the CDC is really setting the floor, so to speak, so the very bare minimum that everyone could do. So we can't do less than what the CDC says, but we can always do more. And many, many times our county has done more. And so I think we're seeing where this causes some confusion, and rightfully so. And I really I think that's the way that things are communicated more than anything that's confusing. But just wanting to make it clear that if our county decides to do something that goes, let's say, above and beyond what a state or a CDC says, that is not them doing anything wrong. That's not them going rogue. That is completely within their jurisdiction and really within their right and responsibility. And we should embrace that, because that tells us that our local leaders are paying attention to what is going on right here, because we know that this pandemic is impacting different places differently, and we want our local officials to be looking at what is happening right here and not necessarily just blindly going by what is going on at the federal level or even the state level. And so we've had a good example of this just pop up, wherein the state made a decision to drop the quarantine requirement for unvaccinated individuals. And so we've already not had a quarantine requirement for people who, and this is for exposure. So this is not people who are positive. This is not about isolation. This is about quarantine. And remember, quarantine is for people who are exposed. And so the CDC has said that those who are not vaccinated should be in quarantine for 5 days after they are exposed to someone with SARS-CoV-2. And the state decided not to do that anymore. So the state is dropping that quarantine requirement. So that means that our public health officer had a decision to make: stay aligned with the CDC, which is a little bit more conservative, or go ahead and go with what the state was doing, which was a little bit less conservative. And so what our county decided to do was to stay a bit more conservative, keep the quarantine requirement in place. So someone who's not vaccinated, they need to stay home for at least 5 days, stay isolated for at least 5 days after their last contact with someone who has SARS-CoV-2. And here you can see the press release. And what I really like about this announcement is that it says that they may leave quarantine after day 5 if they test negative on or after day 5. So I really applaud the putting in testing requirements. And I think we should be doing that for even for after someone is positive. That is a strong recommendation, but it is one of the great tools that we actually have to see if someone can come out of isolation or out of quarantine in this case. And the quote from our public health officer, Dr. Nicholas Moss, is, "Cases are rising gradually in Alameda County. Moving cautiously with quarantine requirements is prudent, especially while we are still evaluating the impact of the BA2 variant and recent changes in masking policy." So acknowledging what basically I was mentioning before, that as you lift the masking protections, then you are lifting protections for all. And so we want to be able to assess the impact of doing that before we then start removing other protections. And quarantine, particularly of unvaccinated exposed individual, is a protection. So we're going to be keeping that protection in place. And I think this is a good idea where it makes perfect sense and where we need to be able to give our local officials that leeway to go above and beyond perhaps what the state has decided to do. And speaking of the BA2 variant that Dr. Moss mentioned, you can see here that as we look at variants, the light pink here is the BA2. It's really pretty much taking over. Delta is the orange there is pretty much it's looking like it's going to go extinct here, possibly. I guess anything is possible, but that's what it's looking like. And so now we've got this more contagious BA2 variant circulating. It does not appear to be more virulent, but once again, for those who are unvaccinated or the immunity is wearing off, it is recommended that if you're over 50 and it's been more than 4 months since your booster, that you get a second booster. So we're already on sort of fourth doses here. If you're immune compromised, and you may even be on your fifth dose, because remember the primary series for immunocompromised was 3 doses. And so just reminding everyone that it is not uncommon to have 3 and 4 doses of vaccines. This is not anything out of the ordinary. It's probably likely that our original concept of what the primary series of this vaccine was it was done with 2 doses only, very close together, probably too close together, because we wanted to get immunity as fast as possible for as much of the population as possible. But really, ultimately, it looks like the series will probably be most likely a 3-dose series, maybe 4. More time will tell. And so I think we'll just need to sort of stay tuned and keep an eye on what is happening. So, in terms of, going back to what is happening with our schools lifting these universal protections and what does that mean, definitely getting a lot of questions from parents about this. And I want to point out something here, and this is showing the influenza associated mortality from this is from the flu, and this is showing from 2018-19 is there on the far left in the white, and then in that next shaded gray you're going to see 19 to 20. These are pediatric deaths from influenza. So you can see 2018-19, 1920. You can see these significant peaks here with a significant number of deaths in our children from the flu. Now look at what happens in 2021 and even this year in 21-22, where it has really gone down quite substantially. And this is really this is a result of masking in schools. Remember, 2021 we did have school closures for some time. But now 21-22 we've had schools open, and yet we've still managed to suppress flu and eliminate or greatly reduce flu deaths in kids. So I say this to say that there are benefits of masking that have shown to be effective, even for something that we used to just accept, that people were going to get the flu. We did flu vaccines, but this is pretty remarkable, and I thought it was worth pointing out. And I will say that at this point, there's so much going on with the law and with everything that is going on with recommendations versus mandates. And it's quite contentious and somewhat disappointing in many ways. But one thing that I will note is that the communities who suffer from disability, who often have been marginalized and been left out by policies, are certainly speaking up as protections are lifted during an active pandemic. So it is one thing when we have something like the flu, which is endemic, and we can pretty much predict when we're going to have waves and what they're going to look like. But to be in an active, unpredictable, evolving pandemic and have universal protections such as masking removed from schools is raising major concern for all kinds of families, but particularly those who the children have immunocompromising conditions, and where everyone not masking is going to put those children at risk. So there is a case in Virginia that we're keeping an eye on, where 12 families have sued. And a judge agreed with them that they can challenge the governor's order against school mask mandates. So they filed an injunction. And so for the moment, they are prevailing and able to keep those masks on in schools to protect the rights of their children who have disabilities. So I anticipate that there will be quite a bit more of this type of activity, since this kind of laid some of the groundwork for people who are vulnerable, immune compromised, and who are being made more vulnerable by removal of universal protections. And so this is something that will be worth keeping an eye on as we go forward. And of course, the latest in terms of protections being removed is the dropping of mask mandates on airplanes and public transit. So you may know that last week the CDC extended the mask mandate through May 3rd. And this was a requirement that applies to not just airplanes and airports, but it applies to public transportation, buses and trains, and so on. But then a federal judge basically struck down this mandate, and saying that the CDC doesn't have the authority to do this. And so at the moment, not sure what's going to happen from a legal perspective, whether that's going to be challenged or what's going to happen. But right now, where it stands is that there is no mask mandate for airplanes, airports, or any public transportation. And of course, this is quite a concern, particularly, I think, for ground transportation, where I don't know what ventilation we have going on our trains and buses and so on. And we tend to have essential and frontline workers using public transportation. These are also the same folks who may live in crowded households, and are at risk just by virtue of being on the public transportation, let alone now not having mask protections in place. So this is, of course, concerning. And I think that the precedent of saying that the CDC doesn't have jurisdiction here is also concerning, especially when it comes to air travel, because so far as I know, this is actually the kind of thing that the CDC does have jurisdiction over. Sort of the transport or importation of an infectious agent on an airplane. Public health officers have always been able to stop someone from TB, let's say, from boarding a plane. So this is one of those instances where actually I think the CDC does and should have jurisdiction. So a little concerned about the precedent that may be set with this particular ruling, but nonetheless, at this point, it's really gotten pretty out of control. I saw a report that in 2021, really cases of violence on airplanes over the masks spiked. There was over 5,000 incidents reported by the TSA in 2021, and over 70% of those were related to masks. So violence in the airports and on airplanes over masks. It's just, it's very hard for me to comprehend why this is necessary and why people are feeling so strongly about something that is a public health intervention during an evolving pandemic that involves a airborne infectious agent. I mean, it seems like a no-brainer to me, but apparently now we're going to really have to do harm reduction because you've got people getting beat up on planes because of it. And at this point, if you're going to have to fly, it's best to understand what that risk is and make a determination. I've already been hearing from people saying they want to cancel trips that they had booked because they had done so, having carefully done their own risk assessment and thinking that they would feel comfortable because of masks being in place. But now that they're no longer in place, I know a lot of people are feeling uncomfortable about that. We're already hearing multiple airlines saying that they are indeed going to drop mask requirements. Amtrak has already said so as well. So I guess we'll have to wait and see what BART, AC Transit, and the rest decide to do. And as it relates to being in an airplane, when the air is on and circulating, then the filtration should be fairly decent. But this is a relatively small vessel with quite a number of people in it. Certainly have seen many anecdotes of how poor the ventilation is during boarding, onboarding, and offboarding from the plane because they may stop the air circulation, and really it becomes sort of this small incubator where certainly particles can absolutely accumulate. So it will be the same things we've talked about many times. If you're going to be indoors in a setting like that, then a high filtration mask is going to be your best friend. And if others are not masking, then it's what is called one-way masking. So in that case, you're really going to want the best filtration mask you can, the best fitting that you can, and certainly keeping it on, ideally the entire time, but especially during boarding and deplaning. Those are really some of the more concerning points in time on the airplane. But certainly if you can keep a well-fitted N95 or KN95 mask on your face the entire time, then that is going to be your best bet. Of course, shorter flights are going to generally be safer than longer flights. And then other than that, it's really the proximity of if there's someone who has SARS-CoV-2 sitting next to you, that is very different than someone sitting, far away from you. But of course, you're not going to know who's who because testing isn't really being enforced very well either. One new innovation I'll mention quickly, the FDA has approved the use of a breathalyzer test for SARS-CoV-2, and results come out in 3 minutes. I personally would happily take this test before boarding a plane, and I think that it's even less invasive than the airport security things we have to do now, taking off shoes and whatnot, and it could really be a lifesaver. Something tells me if we can't agree to masks, we're not going to agree to testing either. But these are the kind of tools and innovations we should be using if we really are trying to stop the transmission of this very tricky and really quite evil virus that unfortunately still is harming and killing people and causing quite a major burden of long COVID, which I am going to update in a future briefing because there's more and more information coming out about long COVID all the time. And in the meantime, if you do catch SARS-CoV-2, you are someone that you care about, please, please, please inquire about outpatient treatment. We're still having people in the community losing their lives, and this is unacceptable. Anyone who dies from SARS-CoV-2 at this point, I really think we all need to be asking questions. We know that vaccines are the biggest differentiator, but the treatments are also quite effective, and there is no reason at this point why anyone should not be able to access at least one of these outpatient treatments, and you only need one. And so we've got Paxlovid, Remdesivir, monoclonal antibodies, Molnupiravir. Out of these, you should be able to qualify for one. Most people would, and as long as you started in time, within 5 to 7 days, then this can really change the whole trajectory, the whole course of the illness, and save your life. So please familiarize yourself with this and make sure that, especially if you know anyone who's unvaccinated, We still want them to reconsider and get vaccinated because that is going to be the biggest difference. But either way, vaccinated or not, there is ample supply now of these treatments. So please, please don't hesitate to ensure access to these treatments. And once again, to prevent the most serious and tragic outcomes, vaccination and booster, particularly if you're more than 4 months out and over 50, it may be time for your second booster. But if you haven't gotten that first booster yet, now is a good time, as long as it's been 6 months since your primary series, really to help you mount that adequate response that we are seeming to need against Omicron and its subvariants. And so if you don't have a primary care provider, please get one. Let's eat a balanced diet, get some exercise, get some fresh air, some sunlight, manage your stress, and get a good night's sleep. Thank you so much for joining us. Look forward to seeing you next Tuesday at 10 a.m. See you then.